Hey guys, this is my Module 3 blog. I am going to start with the leadership skills questionnaire that we had to do. I scored 27 for administrative skill, 29 for interpersonal, and 28 for conceptual. All of these were in the very high range. I do currently hold a leadership position, but I guess I have always underestimated my leadership abilities. This does kind of reassure me that maybe I will be a pretty good leader. After all, I do hold a position called the coordinator of our joint replacement program. I work with all of our patients that come in to have their hips, knees, and shoulders replaced. So some of the skills that I use every day in my job are planning, organizing, directing, coordinating, and case management. I do a lot of planning. I'm a planner, so I try my best to plan ahead. I keep an eye on our physicians, our surgeons' surgery schedule, and I email that out to our nurses who we have designated as joint nurses. We have selected certain nurses who meet our expectations of providing excellent care to our patients. Not that all of our patients don't receive excellent care, but as we tell everybody, our joint replacement patients are not sick. They don't come to the hospital because they have to. They choose to come to our facility to have their joints replaced to make their life better. So we need to do all we can to give them that excellent experience and make sure they have an excellent outcome. So I do a lot of planning on behalf of making sure we have the appropriate staff. I don't actually make the schedule, but I do work very closely with the clinical nurse supervisor who does that for our med-surg unit. I do a lot of planning with our joint replacement classes. We hold certain events with our joint replacement program, which also involves a lot of organizing. The classes are held twice a month, so I have to schedule the patients for that, make sure they have the appropriate tools for class, and making sure all of our staff have the appropriate tools they need to do their job as far as education. I do some directing, and by the textbook on page 155, the five levels or concepts of directing include giving direction, supervising, leading, motivating, and communicating. I do a lot of communicating between the nurses, patients, and the physicians. I'm kind of a liaison amongst all of them. Supervising, I am there for our nurses if they were to need any direction or assistance. I was one of our initial joint replacement nurses when we first started our program around 2011, so I've been there. I know what it's like to take care of these patients on the floor. Giving directions, I'm there if they have any questions. I try to be a good leader based on my past experiences. And then motivating. I do my best to motivate our nurses to take excellent care of our patients. As a lot of people say, one bad experience spreads through a community like wildfire. It takes several good experiences for everybody to know that they can have the same excellent outcome at our facility as they can at larger ones within an hour, 45-minute drive from us. I do a lot of coordinating between the doctors, the nurses, the patients, the other staff on our unit, the director and the clinical nurse specialist on our med-surg unit, and then case management. I set up any kind of home health needs. I make sure our patients have the appropriate resources at home, and if they need to go somewhere for rehab, I work on that as well. So the different departments that I work with currently, and I will continue to work with, are our same-day surgery center, patient registration, lab, our med-surg unit, the operating room, the surgeon's office and their office staff, the different home health agencies in our area, and also our current case management department, as this is a new task I've started doing over the last year and a half to help take the patient load off of our current case managers. As far as our structure of our facility, it's fairly small, so it's kind of horizontal and it's kind of vertical. It's not a super steep triangle, but it is not a total rectangle. We do have the different levels. We have the president, the VPs, the CNEs, the directors, the clinical nurse supervisors, which are the same as assistant directors, and then we have our floor staff. And the CNEs are over several different departments. They may be over med-surg, ICU, and OB, or ER and housekeeping and whatnot. So it does kind of spread wide, but it does also spread up. And as far as the method of providing patient care that I am most used to and I find to be most effective is the total patient care method. Most of our nurses, actually all of them, do work 12-hour shifts. So the idea of having a primary nurse that works 8-hour shifts, that does most of the patient care for a 5-day span, is not really realistic in our environment. So total patient care gives the opportunity for a nurse to take care of the patient on a 12-hour shift. They have their assigned patients, usually anywhere from 4 to 7 patients depending on the shift and the acuity level. And if they are scheduled several days in a row, they will have the same patients, just for the idea of continuity of care. Trying to think of what else I need to say. I think that's about it. I do look forward to this class. I'm just now going full-time with my joint replacement patients as of this week. So I do have a lot of leadership skills to build to best do my job. So I do look forward to this class and listening to everybody else's posts.